Hey Zol, do you know we have movies related to COVID-19 pandemic?
Yes, I remember that there are two movies with many similarities.
One of them is Outbreak. It was released in 1995, way before we were born. It talks about the Motaba virus. Motaba virus is a fictional Ebola virus with 100% fatality rate. It was first found in African jungle and spread to the American cities because of a monkey.
A monkey?
Yes, the monkey was the host animal, the animal that carried the virus in its body.
Interesting. But do you know about Contagion? It is a movie released in 2011 that talks about the MEV1 virus. The virus is actually quite similar to our coronavirus. In the movie, I noticed that many standard operating procedure or SOPs were similar to what we are experiencing today. Wow, these movies look very interesting. Now, let's have a look at the movies.
In a remote African jungle, a small monkey is captured. Bound for a pet store in America, the animal carries a deadly virus.
Now, I know that some of us have doubts about what we're about to do. We'd be less than human if we didn't. But the fate of the nation, perhaps the world, is in our hands. We cannot, we dare not refuse this burden. I'm confident that each of you will do his duty. God forgive us.
Your town is being quarantined.
We got 19 dead. We got 100 more infected. It's spreading like a brush fire.
What are you talking about?
If one of them's got it, then 10 of them have got it now. And if one of them gets out of Cedar Creek, we have a very interesting problem.
If that bug gets out of there, 260 million Americans will be dead or dying.
I'm leaving with the team in an hour.
From the heart of a small California town
Damn it, Sam, I want to save these people same as you.
to the inner circle of power in Washington.
The most optimistic projection for the spread of the virus is this: 24 hours, 36 hours, 48 hours.
The greatest medical crisis of all time
We can't stop it.
begins.
Try to remain calm.
Many people are dying and are going to continue to die unless we find this monkey.
There will be panic the likes of which we have never seen.
There you are!
In the beginning of the movie, there is a quote by Joshua Lederberg. The single biggest threat to man's continued dominance on this planet is the virus. The quote is quite interesting, yet true to life. A virus is an invisible enemy where we cannot see it with our naked eyes. It can be transmitted in many ways, such as airborne, droplets, or fomites, and mutate very fast by the time we notice. In the film, when the main actor reached the village, he was only able to see the dead bodies of the villagers. The Motaba virus had taken away most of villagers' life 2 or 3 days after they were infected. This also reflects the current situation of COVID-19, showing how deadly a virus could be, and it threatens man's life. Many did not even notice they were infected until a symptom appeared. Those with chronic diseases may even die, although they have just recently tested positive. Sacrificing human life is wrong because all humans have the same right to be treated equally. Every life counts and shall be respected. In the film, they bombed the village camp to prevent the outbreak of virus and decided to do the same to the infected people in the town. It is unethical to sacrifice one's life for the benefit of other humans. Besides, they are actually committing crimes because those who sacrifice are innocent people. Instead, there are many other ways to solve the problem. For instance, quarantine infected people, and advised the public to stay indoors. Meanwhile, health personnel shall work hard to develop vaccines. We should find ways to save human lives, but never to sacrificing others. Sacrificing human life could be the right action when it is for greater good, such as to save more lives. In the context of a pandemic, healthcare workers who act as frontliners such as doctors and nurses are risking themselves to save many more lives. Without them, human species might be endangered, as viruses are capable of wiping out a large population. During this COVID-19 pandemic, the frontliners have been putting their own life at risk. Siti Aisyah, a 26-year-old nurse, was one of many Malaysians who lost her life to the virus. Her willpower stands out when she continues to serve patients till her last breath, despite being heavily pregnant. Another heartbreaking case reported was of a retired 68-year-old nurse, Bibi Maiden, who willingly volunteered herself to return to service and extend a helping hand in the battle against COVID-19. She was aware of the shortage of medical workers to cater to the needs of patients for the sake of our people.
Let's see what went wrong in Outbreak. In the movie, Usamrid synthesized an anti-serum for the virus Murtabak variant in a very short time. Once the host animal, Betsy the monkey, is captured, Salt is able to create a drug treatment in just a couple of hours. In reality, there are so many steps and legal procedures you would have to go through before administration. Moreover, the development of the vaccine usually takes about months or years.
It was a groundbreaking ceremony for a new factory.
Did she mention seeing anyone who was sick? Anyone on a plane, the airport?
No, she said she was jet-lagged.
The average person touches their face 3 to 5 times every waking minute. In between, we're touching doorknobs, water fountains, and each other.
Beth.
Mom?
No, go up to your room, honey.
So we have a virus with no treatment protocol and no vaccine at this time.
You had a seizure this morning, Beth.
Does she have a history of seizures?
No.
Allergies?
As of last night, there were 32 cases.
Unfortunately, she did die.
Right. So can I go talk to her?
Mr. Amoff, your wife is dead.
What are you talking about?
Okay.
What happened to her? What happened to her?
Is there any way someone could weaponize the bird flu? Is that what we're looking at?
Someone doesn't have to weaponize the bird flu. The birds are doing that.
Watch this. It's transmission, so we just need to know which direction.
On day 1, there were 2 people, and then 4, and then 16. In 3 months, it's 1 billion. That's where we're headed.
They're calling out the National Guard. They're moving the president underground. People will panic.
Get away!
It will tip over.
The truth is being kept from the world.
Cook your samples, destroy everything.
Hello. I need you to get me the names of everyone who serviced this room. It's an emergency.
You can't panic now.
I know.
I'm gonna get you home.
I got people too, Dr. Cheever. We all do.
Don't talk to anyone. Don't touch anyone. Stay away from other people.
Let's talk about the characters in Contagion. Starting with Dr. Orantes, the World Health Organization epidemiologist. She was kidnapped by Shang Feng as ransom to get the vaccine against MEV1 virus. Instead of giving the real vaccine, placebos were given to the villagers in exchange for Dr. Orantes. Placebos does not contain any active substances to treat MEV1 virus infection, hence cannot protect the villagers from the virus. Now, let's watch a short video to further understand the concept of placebos.
By the 1950s, researchers were using placebos as a standard tool to test new treatments. To evaluate a new drug, for instance, half the patients in a trial might receive the real pill. The other half would get a placebo that looked the same. Since patients wouldn't know whether they'd receive the real thing or a dud, the results wouldn't be biased, researchers believed. Then, if the new drug showed a significant benefit compared to the placebo, it was proved effective.
What's that?
Your vaccine. The one you took was a placebo.
Upon knowing the truth, Dr. Orantes immediately walked away, and she was most probably heading to the village to warn the villagers about the placebos. If she really did so, her action should be respected, as she may have saved hundreds of innocent lives from getting the infection. Moving on, Dr. Mears was an Epidemic Intelligence Service officer from the Center for Disease Control. She was sent to Minneapolis to trace everyone who had contact with Beth, who was the first patient that got infected by the MEV1 virus. Soon after, she got infected and died due to the lack of protective equipment. In this movie, Dr. Mears did a great job whereby when Dr. Mears found out that she had been infected, she quickly called the hotel's management to trace everyone who serviced her room. She really did a good job here because this action can help to locate the possible cases of infection and prevent the spread of the virus. However, Dr. Mears would not get infected in the first place if she wore the protective equipment when she was on duty. Due to her negligence, she got infected as the virus was airborne and spread through fomites. Next, we have Dr. Alice Cheever. In this movie, he was a medical officer in the Centers for Disease Control and Prevention who led the task force to contain the new MEV1 virus. For your information, Dr. Cheever made the right decision to request an announcement to stop any research on the virus in labs other than Biosafety Level 4 when he found out how severe this virus can be and there was no vaccine and treatment available at the moment.
From here on out, I want no one working on this except the PSL-4. The last thing we need is for this thing to walk out of the lab on the bottom of someone's ship.
Despite being the leader of the task force, Dr. Cheever showed favoritism to his loved ones by spilling about the quarantine in Chicago to his wife before the public. He did that in hope his wife would leave Chicago and go to a safer place. However, this act was unethical and breaching the government rules.
I want you to get in your car, and I want you to drive down here to Atlanta right now. You hear me, Aubrey?
Dr. Cheever was incautious when he wore vaccination tag, where in reality, he did not even get vaccinated because he gave his vaccine to Roger's son. The tag was supposed to be the proof that one had been vaccinated from the MEV1 virus.
Dr. Ellie Hextall was the scientist who worked on MEV1 vaccine development. Did you know her inspiration was Dr. Barry Marshall?
Do you remember Dr. Barry Marshall?
Dr. Barry Marshall is an Australian physician, Nobel laureate in Physiology of Medicine, Professor of Clinical Microbiology, and co-director of the University of Western Australia Marshall Centre. Marshall and Robin Warren showed that the bacteria Helicobacter pylori have a key role in development of many peptic ulcers, defying decades of medical belief that ulcers are predominantly caused by stress, spicy meal, and too much acid. Dr. Barry Marshall ran an experiment on the only human he could ethnically recruit, himself. He took some Helicobacter pylori from the gut of an ailing patient, stirred it into a broth, and drank it. Finally, he proved unequivocally that bacteria were the underlying cause of ulcer. This breakthrough in comprehending the causative relationship between Helicobacter pylori infection and the stomach ulcer has been made possible by this discovery. Both Dr. Ellie and Dr. Barry Marshall are willing to sacrifice for science. They risked their life by running the experiment on themselves. Dr. Marshall drank a broth containing cultured Helicobacter pylori, whereas Dr. Ellie Hextall injected herself with the experimental vaccine.
Lastly, there was an antagonistic character named Alan Crumweed who was a blogger and a conspiracy theorist. He rattled out online jeremiads, and spread the rumors which caused panic in society.
You're familiar with Forsythia?
No, I'm not.
What I'm about to tell you is backed up by testimonials that will appear shortly in the popular media. I'll be talking about it extensively in the days ahead.
He told the public that a remedy called Forsythia can be used to treat the virus. As he told people that Forsythia works, people panicked and raided the pharmacies to get Forsythia instead of waiting for the real vaccine to be available.
You will only be able to give out 50 doses today. That's our Forsythia. I love it.
We can relate the movie scenes to the recent pandemic situation. One of the rumors is that traditional medicine and certain ingredients, such as garlic, ginger, are effective to treat COVID-19. Similarly, ivermectin is being said to be effective to treat COVID-19. However, up to July 2021, there is no comprehensive clinical data available to support their use as treatment for COVID-19 infection. Thus, we should be cautious of the information we read and share on social media, especially from untrustworthy sources.
In Contagion, Dr. Hextall and Dr. Shiva sequenced the genome of MEV1 virus within 6 days. This is illogical because solving the sequence of the virus's genome normally takes a long time, from months to years. Scientists in China took a month to sequence the virus's genome of COVID-19 after the first case was reported in Wuhan on 8 December 2020. Another science wrong is the CDC officers. Dr. Erin Mears went for the epidemic investigations alone in Minnesota. In reality, we should have a huge team with varying expertise for an emerging outbreak like this, because it involves multiple steps for an epidemiologic field investigation. For example, for the first 2 cases of H1N1 in San Diego, CDC sent about 5 EIS officers in the first wave with other support staff.
There are some life lessons we can learn from the pandemic. Firstly, it is important to practice personal hygiene such as washing hands. Since we are fighting something extremely small, we can't see it with our naked eyes. Therefore, everyone has to keep in mind that the danger is real. Another life lesson is that we should be grateful for being able to socialize before the pandemic, as we are unable to meet with friends and even family during the pandemic. Next, as a prevention method to curb the spread of the outbreak, everyone should practice WSSAH, which is we should stay at home. WSSAH also stands for wearing face masks, social distancing, self-isolation, avoid body contact, and hand washing.